Hello everybody, my name is Celeste Borsato. I'm a student at Ensign College and I'm taking anatomy and physiology class with Brother Borges. And I imagine you're wondering, who's this baby in my hands? So no, she's not my daughter, but I named her. Her name is Emily and she's here to help me talk about a medical condition called hemangioma. So here I prepared for you a chart with characteristics, symptoms, and treatments of the hemangioma. So an hemangioma is a benign, so non-cancerous tumor of blood vessels that can be found anywhere in the body. So mostly, the most common cases are in the head, the scalp, the chest, or the back of an individual. So since the infantile hemangioma is the most common, and I have Emily with me to explain a little bit more about it, I want to start talking about this. So the infantile hemangioma develops from the 2nd to the 8th week of life of a baby. So it's not born with the baby. And it also involutes between 5 to 9 years. So when a child is around 10 years old, her hemangioma should be gone, because it involute means that it stops growing and it disappears. The prevalence of the infantile hemangioma is mostly in girls with white skin, just like Emily. So Emily, she has an hemangioma in her head, just like this example of this child. Yeah, this type of hemangioma don't hurt, don't usually require treatment since it involutes and it doesn't prejudicate the normal function of the body of a child. Unless in the case of this child I brought, for example, the hemangioma is in the eyes, and this can stops the normal function of the vision of the child, so it needs to be treated. I wanted to head and start talking about the congenital hemangioma. This type of hemangioma is present at birth, so a child is already born with this tumor, and this tumor can be complete by birth, or it can grow together with the individual. And it doesn't have prevalence in men or female, it's equal for both, and is most treated surgically. And I want to invite a special guest to talk a little bit more about this type of hemangioma, because he has one. So I want to invite my fiance.
I have one.
Yes. Evan Brito.
Hello everybody.
Has an hemangioma, and his type of hemangioma is a congenital hemangioma, but his case is deep, because you're probably wondering, where's the hemangioma? His hemangioma doesn't look any like Emily's, as you can see. Can I zoom in your face?
Mm-hmm.
Okay.
I'll let you do that. Let me hold Emily for you.
Thank you. Okay. So here I showed the superficial hemangioma like Emily's, and Ivan's is like the deep hemangioma, or it can also be called subcutaneous. So here in his face, you see the characteristics of a deep hemangioma is the skin is a little bit swollen, as you can see here on the side, and has a blue tint to it, and also here in his mouth has a little purple to it. So Ivan, he already been through some treatments, and I want to ask him which was the treatment he's been through.
I've been through surgeries and through an injection. I have done 3 surgeries. They were pretty similar. The doctor would open my face around, and I think he would open it and kind of remove or burn the... I don't want to know much about it. But yes, I did 3 of these surgeries. And then he suggested me to use an injection that supposedly would stop the growth of the tumor.
That's perfect. Thank you so much for your help.
No
I
problem.
can take Emily back.
Thank you, Emily, back.
Okay. So yes, when it's an infantile hemangioma, you can also be treated that way in case it's prejudicating the normal function of the body. Just like Ivan did, a surgery or injections, it's a good way to treat an hemangioma. There is the last type of hemangioma I want to talk about today, which is another common type of it. It's called the cavernous hemangioma. I want to talk about. It's called the cavernous hemangioma. So this type of hemangioma is inside the body. It can be in the lungs, in the liver, in the brain, anywhere inside. And this type of hemangioma can be only detected through the ultrasound or tomography, since you can see it like Emily's and Ivan's. Here I brought an example of a cavernous hemangioma in the brain. Thank you. Pain can only occur in the hemangioma if there is a bleeding, or if this hemangioma, this excess of blood vessels it's pushing an organ inside the body of this patient. I also brought here another example. This one is a picture of a liver hemangioma. As you can see, the blood vessels accumulation is right there in the liver. Although most of the hemangiomas don't need treatment since it doesn't cause pain or it doesn't stop normal function of the body, when it does, it can be very dangerous to an individual. It can even cause a stroke. So it's very important to always accompany an hemangioma and a malformation with a doctor. Moving towards the end of this presentation, I want to talk about one fun fact about this medical condition. So since there is no specific cause for an hemangioma to appear at a patient, there is one thing that can be identified. It's the genetic of it. So if a parent has an hemangioma, a child has 50% of chance to have it too. Thank you so much for your time in watching my presentation, and have a great night.